Chemotherapy is already tough nausea, fatigue, worry, but some everyday foods might be making it even tougher without you realizing it. You see, when your body is fighting cancer and trying to rebuild from the inside out, even the smallest decisions, like what goes on your plate, can have a huge impact. Food isn't just about calories anymore. It's about healing, about strength, and sometimes about survival. Now imagine this. You're sitting in your kitchen, the same kitchen you've used for decades. You've just finished a treatment session. You're tired, a bit nauseated. You want something comforting, maybe some soft-boiled eggs or a bit of tuna sashimi, because that's what usually settles your stomach. But what if I told you that very choice, however soothing it might feel, could be increasing your risk of infection right when your immune system is weakest? Let's step into the story of Margaret. She's 72, a retired teacher from Ohio with a love for gardening and crossword puzzles. After being diagnosed with breast cancer, she began chemotherapy with a positive attitude. But just a few weeks in, she ended up back in the hospital with a high fever and chills. The doctors ran some tests and found a bacterial infection likely from something she'd eaten. Turns out Margaret had made herself her favorite eggnog from scratch, complete with raw egg yolks. The doctors explained something crucial during chemotherapy. Your white blood cell count drops. These cells are your body's defense line. Without enough of them, your immune system can't fight off bacteria the way it normally would. Raw or undercooked foods like sushi, rare meats, soft eggs, or even homemade Caesar dressing become risky. They can carry bacteria like Salmonella or E. coli, which may be harmless to a healthy person, but dangerous during treatment. According to the Centers for Disease Control and Prevention, foodborne illness hospitalizes over 128,000 Americans each year. But cancer patients on chemo are significantly more vulnerable. One study published in the Journal of Oncology Nutrition found that patients undergoing chemotherapy are nearly 10 times more likely to develop serious complications from foodborne bacteria. So what does this mean for you? It means food safety isn't just about washing vegetables anymore. It's about fully cooking everything, eggs, meat, seafood, and avoiding anything that's raw or unpasteurized. No sushi nights, no raw cookie dough, no soft-boiled anything. Not for now. Let's move on to something that might surprise you even more. Grapefruit. Yes, the humble, healthy-looking grapefruit. You've probably been told it's full of vitamin C and good for digestion. And that's true for most people. But if you're on chemotherapy or taking certain medications, that innocent-looking fruit can actually become dangerous. Here's what happened to George, a 68-year-old grandfather from Phoenix. George started chemo for lymphoma and tried to eat healthier, lots of fruits and greens, freshly squeezed juices, and a big grapefruit every morning. But soon he noticed his side effects felt stronger than others had described: dizzy spells, confusion, extreme fatigue. At first, his doctors thought it might just be the chemo. But when they looked closely at his medication levels, they realized something strange. His body wasn't breaking down the drugs the way it should. The culprit: grapefruit juice. You see, grapefruit contains compounds called furanocoumarins. These compounds interfere with an enzyme in your liver called CYP3A4. Now, that enzyme's job is to process and clear certain medications from your body. When grapefruit blocks it, medications can build up in your bloodstream to dangerous levels. This isn't just theory, it's backed by science. A study published in the Canadian Medical Association Journal reviewed 85 different medications affected by grapefruit, including several chemotherapy drugs. Some of these interactions can increase drug levels by over 300%, turning a therapeutic dose into a toxic one. And it's not just grapefruit. Grapefruit juice, Seville oranges, and pomelos can have similar effects. But grapefruit is the most common offender. That's why oncologists like Dr. Rachel McKinnon from Johns Hopkins recommend reading the fine print on every medication label. As she says, even a healthy fruit can become harmful if it interferes with life-saving treatment. So what can you do instead? Switch to fruits that are safe and beneficial, like blueberries, bananas, and cooked apples. They're gentle on the stomach, rich in antioxidants, and won't mess with your medications. If this is resonating with you, I'd love for you to comment with your age or where you're watching from. It's wonderful to know we are on this journey together. There's so much we can learn from each other. And make sure to keep watching, because coming up, there's a food many people turn to for comfort during chemo, but it might actually be making nausea and diarrhea worse. You won't want to miss that. Let's pick up where we left off, because the next one is sneaky. It hides in comfort foods, takeout meals, and even some well-meaning homemade dishes. I'm talking about greasy fried or heavily spiced foods. You might be craving that golden fried chicken, or maybe a plate of spicy enchiladas to give you back a sense of normalcy. After all, food is emotional. It brings back memories, offers comfort, and helps you feel grounded when everything else feels uncertain. But here's the tough truth. These kinds of foods can make nausea, diarrhea, and fatigue even worse during chemotherapy. Let me tell you about Linda. She's 70 lives in Florida and was always the first one to bring her famous chili to church potlucks. When she began treatment for colon cancer, her appetite vanished. She lost weight and energy fast. Her son brought over takeout, fried shrimp, and hot wings to cheer her up. But the next morning she was curled up in pain. The nausea hit like a wave and she couldn't keep anything down. Her doctor explained what was happening. During chemo, your digestive system becomes extra sensitive. The treatment irritates the lining of your stomach and intestines. When you add spicy or greasy food into the mix, it's like pouring hot sauce on a sunburn. That inflammation gets worse. You feel it as cramps, bloating, nausea, or emergency bathroom runs. A study published in the journal Supportive Care in Cancer followed 112 chemotherapy patients and found that those who consumed high-fat or spicy foods reported a 40% increase in gastrointestinal side effects. That's a big number. But the solution doesn't have to be bland. Think about switching to gentle, nourishing meals like baked sweet potatoes, soft-cooked oatmeal, steamed fish, or rice with well-cooked veggies. These foods are kind to your gut. They provide fiber, vitamins, and minerals without the irritation. Dr. Neha Shah, a registered dietitian specializing in oncology nutrition, says, your digestive tract is already inflamed during chemo. The goal is to calm it, not challenge it. Choose foods that comfort without chaos. And here's a little tip from a patient named Roger. He's 74 going through chemo for prostate cancer. Every evening he sips a warm mug of bone broth with a pinch of turmeric. It's soothing, anti-inflammatory, and gives him protein and electrolytes without upsetting his stomach. Now, speaking of safety and comfort, there's another category you might not have thought twice about, but it's one that can carry very real risks if you're undergoing treatment. I'm talking about unpasteurized products. That includes unpasteurized milk cheese juice, even things like homemade soft cheeses or raw apple cider from the farmer's market. These items can harbor dangerous bacteria like Listeria or E. coli. Here's what happened to Samira, a 66-year-old breast cancer patient who loved natural foods. She believed in raw, local, organic everything. Her daughter brought her fresh, squeezed orange juice from a nearby orchard. But just a few days later, Samira developed a fever and terrible stomach cramps. She ended up in the ER with a bacterial infection. The reason that juice hadn't been pasteurized, that means it hadn't been heated to kill harmful bacteria. For a healthy person, their immune system can usually fight off those germs. But when you're in chemotherapy, your immune system is suppressed. That bacteria doesn't just make you sick, it can become life-threatening. The FDA has clear warnings about this. Pasteurization is a crucial process that helps ensure food safety. Without it, even a sip of juice or a piece of brie can become risky. So what can you do? Red labels. Choose only dairy products and juices labeled pasteurized. If you're not sure about a cheese or cider, skip it or ask your doctor or dietitian. Here's something reassuring. Most major grocery stores already stock pasteurized versions of your favorites. You don't have to give up everything. You just need to be a little more mindful and careful. And remember, this isn't about fear, it's about empowerment. The more you understand what your body needs and what it needs to avoid, the more control you regain over your healing journey. If you're still watching and finding these lessons valuable, please comment the number 1 below, just so I know you're still with me. Thank you for your precious time. It means a lot to have this moment together. And stick with me, because next we'll talk about one everyday beverage that many people use to relax, but for someone going through chemo, it might be doing more harm than good. Now let's talk about something that's deeply familiar, often comforting, and woven into daily life. Yet during chemotherapy, it can quietly work against you. Alcohol. Whether it's a glass of red wine at dinner, a cold beer with friends, or a celebratory toast after a long day, alcohol holds emotional space in many lives. It helps us unwind, feel normal, feel social. But during chemotherapy, it can become more than just unhelpful. It can be harmful. Take Bill, a 69-year-old retired firefighter from Michigan. After his 3rd round of chemo for lung cancer, he noticed his fatigue was getting worse, and his mouth was developing painful sores. At first, he chalked it up to the treatment, but his oncologist asked him a simple question: "Are you still drinking alcohol?" Bill admitted to having a small whiskey each evening. Nothing crazy, just part of his nightly ritual. But what his doctor explained next changed everything. Chemotherapy already puts a massive load on your liver. That's the organ responsible for breaking down and clearing out chemotherapy drugs from your body. Alcohol adds even more work to an already overburdened liver. It's like asking someone with a sprained ankle to run a marathon. Studies have shown that alcohol can increase the toxic effects of chemotherapy by slowing down drug metabolism, which means the drugs stay in your system longer, increasing side effects. Not only that, alcohol also contributes to dehydration, a serious concern when you're already losing fluids through vomiting or diarrhea. In fact, a 2021 study published in the Journal of Clinical Oncology showed that patients who consumed alcohol during chemo reported significantly higher rates of fatigue, nausea, and mucositis. That's the painful inflammation inside the mouth and digestive tract. So while it might feel like a glass of wine is harmless, the truth is your body sees it as a toxin. And right now, your body needs all the support it can get to process powerful treatments and repair damaged tissues. Even small amounts of alcohol can interfere with medications used to prevent nausea or infections. That's something many people don't realize. A harmless drink may be quietly disrupting the support system built around your chemo plan. That doesn't mean you have to give up your rituals. If you enjoy a calming drink in the evening, switch it up. Herbal teas like chamomile, ginger, or peppermint not only relax the body, but can also ease chemo-related nausea and help you sleep better. There's also a deeper win here. Choosing not to drink even for a few months can help your liver recover faster, reduce inflammation throughout your body, and help your gut lining rebuild. That translates into fewer side effects, better digestion, and more energy. And this isn't just theory. After Bill stopped drinking, his mouth sores gradually healed. He was able to eat more comfortably, regain some weight, and his oncologist noticed improved liver function on his blood work. It was one small change that made a big difference. Now let's take a step back. We've covered raw and undercooked foods that raise your risk of infection, grapefruit that messes with your medications, greasy or spicy foods that stir up nausea, unpasteurized juices and cheeses that could carry dangerous bacteria, and now alcohol, which places heavy stress on your liver and immune system. These aren't random items on a list. They're choices that show up in daily life quietly, habitually, and often with the best intentions. But once you understand how these foods interact with chemo, your power grows. You get to make informed decisions that support, not sabotage, your healing. So if you've been wondering, what can I eat? What can I enjoy safely? You're not alone. The goal isn't to create fear, but to guide you with kindness and knowledge. And remember, small changes are powerful. Avoiding that raw egg, skipping the grapefruit, replacing that fried snack with a steamed one, it all adds up. Margaret, George, Linda, Samira, and Bill each made tiny course corrections. And those changes helped them feel stronger, recover faster, and live with a bit more ease during a difficult chapter. Now, I'd love to hear from you. So what was the one lesson today that really hit home for you? Please share one habit you plan on adopting in your life. It could be as simple as switching your orange juice or cooking your steak a bit longer. Let's support each other in the comments below. And if this video helped you, please give it a like and subscribe to the channel. We've got more helpful, hopeful guidance coming your way. Here's to living your best life at any age with strength, with wisdom, and with joy in every step of the journey.